This is part 2 with Dr. Jacob Teitelbaum, and we are going to be talking about sleep, hormones, energy, the stuff that can kind of make or break us, right? And I think it's going to be a really eye-opening discussion. I think you're going to walk away with lots of actionable things that you can do. I think you will feel hope and even some joy based on this discussion and all that we're going to share. And he's going to just share his wisdom with us. And I've learned so much from Dr. Teitelbaum. I'm going to just quickly introduce you. Dr. Teitelbaum is a board certified internal medicine doctor. He suffered from chronic fatigue syndrome as a medical student at an awful time, but eventually got his energy back and has been able to have a very full career treating people with lots of common sense strategies so that people can actually regain their vitality. And that's really what we're talking about today. He's a researcher. He's the author of multiple books that I highly recommend that you read. We will send them all out in the post-webinar replay. If you missed it last time, he's got a wonderful app called Cures A to Z that's free that you can check out. Wonderful resource for just learning about herbs and treatments for different conditions. And so without further ado, Dr. Teitelbaum, tell us how we can improve our energy, doing simple things. How do we have lives where we're more engaged, feeling more joy? Teach us what you have learned over your career.
It's not rocket science. For those of you who like today, I can teach you how in 1 minute you can double your energy, doubling healthy energy. And it's not hard, but I'm going to organize it for you. If you're looking at how to optimize energy, this is what we developed, what we call the SHINE protocol. And an overview is you optimize sleep. So we'll go ahead and talk about the sleep. You need to address the hormonal deficiencies that are widespread despite normal tests, infections, nutritional support, and exercise is able, even if you're near bedbound. There's exercises that are needed to maintain what conditioning you can. So those simple things on a physical level, on the emotional or spiritual level, if you are trying to get energy so you can go back to something you hate, your body will shut you down, no matter how much you want to do it. Well, I've got to support the family. I've got to do this. I hate it. It's sucking my soul dry. Your body will take you out of the game. So use the energy for things that feel good. And you'll find you'll be able to support your energy, support yourself, do the things you need. You'll be amazed how the universe will bring that to you. So shine and follow your bliss. Those two things, and your energy will skyrocket and it'll be healthy energy.
There you go. So that's the roadmap. So how about we dig into the SHINE protocol that you've developed to help deal with fibromyalgia, but it extends to fatigue, really any of these very difficult to treat symptoms that often accompany chronic disease, whether it's autoimmunity, inflammation, cancer, cardiovascular disease, like really it applies to anybody who's got a lot going on with their health.
Absolutely. And there's a good question here too about, well, I'm going to say propaganda because that's what it says. Supplements for all nonsense. Don't rely on supplements. Okay. So when I was in med school and I came down with this nasty viral infection and I was just non-functional, and it was obvious there was a viral infection. You'd see the atypical lymphocyte count was over 25%. And it was clear, but 6 weeks later, I wasn't better. They couldn't identify the virus. So they figured, oh, it must be depressed med student syndrome because we can't find anything. Um, and what I found, I'm a scientist, I'm a science geek. They used to call me the Phantom was my nickname because 2 in the morning I'd be going through the medical library stacks, pulling down journals and just kind of going through, and even going 50 years ago to see what were they up to then and what are they doing now. Um, but here's a little thing to understand. Have you noticed if you watch the national news, I don't care if it's Fox, MSNBC, CNN, it's all a fiction. I know you think, no, 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 ours is right and the other side's is a fiction. It is all a propaganda. It's all nonsense. I'm on all of these networks, most of them anyway. They like me for some reason. I keep telling everybody, turn them off. It's a fiction meant to scare you to death and make you hate each other. Um, and most of what you're learning on the air about medicine is based on who's paying. The news media knows that if they say anything negative about natural medications, supplements, things like that, the advertising money coming in from pharmaceutical things will go up. If they say anything positive about natural remedies, their advertising disappears. And I know, I'll tell you, I mean, I know publishers of major national magazines, and what they've said is the advertising contracts, the drug rep ads come and they say, well, we're looking for a good home for ads. And here's a contract. And it would say things like, you are not allowed to publish anything positive about natural remedies anywhere in this issue as in payment for taking this pharmaceutical ad. So again, all good people. I've never met anybody in the industry who wasn't a love and the pharmaceutical and the doctors, but the institutions themselves are corrupt. So yes, what's this gossip about not relying on supplements? The proper word is propaganda. The science shows the supplements to be very, very helpful. The propaganda you will hear from that your doctor is taught, and they don't know, they think it's science. It's slick advertising masquerading as science. What I will talk about today is what the research shows. As I said, I'm a science geek, and that's what I do. So this will apply not just for energy, but if you have heart disease, and the neuropathic conditions. Last time we talked about pain and neuropathy and other things like that. So I'm going to invite folks today, view this as the doctors are in, where you can ask any questions you want. And I will include the best of natural and prescription therapies. I'm not against medications. I'm just against the insane way they're used based on profit rather than science or common sense.
So you're going to help us sort of blend together your knowledge of conventional Western medicine as an internal medicine doctor
Mhm.
and someone who's very knowledgeable about natural medicines. We're going to kind of blend that together to kind of give you a holistic picture. So let's dig into it.
Right.
S is for sleep.
Sleep. So, people ask, well, what's a normal night's sleep? And, everybody's different. It's like asking, what's the optimal shoe size? There's no one optimal shoe size. I wear a size 12. You know, most of you may have an 8 or a 9 or whatever. It's not one size fits all, and everybody has a different need for sleep. So you see, go to sleep one night where you don't have to set the alarm the next day, see how many hours you naturally sleep, and if that leaves you feeling refreshed and rested. If so, that's how many hours you sleep. To put it in perspective, the average night's sleep until light bulbs were invented a little over 100 some years ago was 9 hours a night average. We are now down to 6 and 3/4. So 8 to 9 hours for most people. That's kind of an optimal. One of the problems is these different conditions will make it hard to sleep and the stress of modern life. That's why I started this episode talking about turn off the things that leave you feeling bad when you're watching the news media. It's again, God bless them, but it's a fiction. I know I keep saying that, but if it's a fiction meant to scare you to death and hate everybody else. If you haven't noticed, try having a conversation with somebody on the other side of a topic on anything these days. This is the
Yeah,
media is doing. So just turn it off, and then you're going to be able to sleep better. Seriously, the stress suppresses the sleep center.
I think a lot there's actually a big role that sleep beliefs play in our ability to get good sleep. There are people who have told me like, I'm afraid to sleep. I'm afraid I'm going to die in my sleep, you know. So there's fear around that. Or people who believe that they just can't sleep. There's just a disorder and it's just never going to be right. They're never going to be able to have restful sleep. And I think that's something we don't really talk about very often. Is that something that you address with patients, Dr. Teitelbaum?
Well, yes, I mostly have worked with CFS, chronic fatigue syndrome, fibromyalgia, long COVID, where the hypothalamic sleep center, that circuit breaker, is directly affected. And you'll see it affected in MS also. So the inability to sleep, it's a real thing. And that's why I started with decrease unnecessary stress, things that you can easily control. Um, Things like ambient light at nighttime, even a night light, can be enough to keep you out of the and in what's called the adrenaline mode, the sympathetic mode, and out of the sleep mode, the parasympathetic mode. So use an eye mask. You can get them on Amazon for 10, 15 bucks. You can find glittery ones or just straight black ones or whatever. Simple things like an eye mask can make a big difference in your sleep quality. Melatonin. I use, personally, the one I use is called EP120, sustained release 10 milligram melatonin. Because I like sustained release, because otherwise you're going to be awake 2 hours later. So it's a good, simple thing. There's a mix of 6 herbs. The revitalizing sleep formula is what it's called. It has 6 different natural components. And this is what I use myself to get solid sleep. So I like my 9 hours a night. Um, Now, there's many other natural things. The smell of lavender. You can get lavender flowers, even dried ones. Put them in a vase. You can get a drop of lavender oil, put it on your upper lip. It will help you sleep. So a lot of natural things. For medications, the trick is if you use a high dose of one medicine, you're going to be hungover the next day. And where if you use tiny doses of several things if you need, it can be as simple as Benadryl. It can 12.5 to 25 milligrams. Trazodone, gabapentin. If you're not on narcotics, gabapentin is a much safer medication than Advil or ibuprofen, in my opinion. And that's really easy for me to document. There are 50,000 deaths a year from Advil in the United States from that family of medication. They advertise. You will not hear about that research in the media, nor will your doctor. But again, trazodone, gabapentin, Flexeril, low-dose amitriptyline. So there's a lot of medications to help maintain sleep. But again, tiny doses, 10 milligrams of amitriptyline, not 200. 25 milligrams of trazodone, not 300. And you'll find you can mix and match these things to get full sleep at night. The red shifted light is less likely to disrupt sleep than blue shifted. That's why you might note on your iPhone and stuff, there's a night mode. So when you turn it on, it's a more reddish light as opposed to the more bright blue that keeps you awake. So the question or the comment that I use red lights at night, it's better, but I would still use a sleep mask. So if you're using it when you need it, yes, red lights are preferred. Somebody's asking about the painful myoclonic jerks. Again, that can be the MS. The gabapentin at bedtime or 90 minutes before bedtime can help, but magnesium can be a big help for that. Whether you take the supplemental magnesium at 200 milligrams, too much magnesium, unless you have kidney failure, is quite safe. The only real downside is you may get the runs, in which case dial it back a bit. But take a bath with Epsom salts. Those myoclonic jerks, a cup or two of Epsom salts you can get at Costco or anywhere they're cheap. They're magnesium salts, and soak and maybe put a couple drops of lavender oil in the bathtub may decrease the myoclonic jerks a bit as well. But again, the gabapentin medication, just low doses, can be very helpful. So for the myoclonic jerks, that's where I would begin.
And as far as a form of magnesium, I'd probably do something like, what do you like? Probably not the oxide and citrate
Any
form.
anything, well, citrates not my favorite. Oxide and hydroxide, I don't use much because they're not absorbed. They go in one end out the other. Any of the chelates, glycinate is a good one, but I usually use malate. Any of the ones that are anything but magnesium oxide or hydroxide, basically.
All right, got that in the chat for you guys. Good. Let's see. Other questions about sleep. I think it's also important to talk about ruling out sleep problems, sleep
Mhm.
apnea being a huge one. I hear a lot of people, with MS and other autoimmune conditions can struggle with restless leg syndrome. So don't be shy about seeing a sleep specialist.
Well, let me give you simple tricks for that. These are things that are not rocket science. If you find yourself not just tired during the day, but falling asleep easily during the day, you watch TV or behind the wheel, you fall asleep, you want to be thinking the sleep apnea or narcolepsy, especially if you have a 16 and a half inch neck size or more. You want to be thinking sleep apnea. If your bed partner is saying that you sound like a Boeing 747 at night, snore a lot, you want to look at sleep apnea. And the doctors can do that test. There are even apps that can be helpful. Restless leg syndrome. If your bed partner notes that kicking them all night, or your blankets are kicked all over the place in the morning. Where your restless leg syndrome is where your legs are kind of running a marathon all night with a jerky movement, and you're not getting restful sleep because you're running a marathon all night. You want to make sure iron level, and the only test is called the ferritin. A regular iron level is useless, but ferritin and iron percent saturation. For ferritin, if the research shows that if that level is under 60, taking iron will decrease the restless leg syndrome. Treating low thyroid will help. Magnesium will help at bedtime. All of these things for restless leg syndrome. Um, and so simple things. So those are the two most common. Those of you may have stuffy nose at night, and do you have stuffy nose all day? It's not if it's just at nighttime. Make sure you're not allergic to dust or your pets that are sleeping with you. But if it's all day, candida or yeast overgrowth, which unfortunately there's no good research. Oh, there is, but not the level I would like. Everything else I'm saying here, I can pull the studies for you in the research report that shows this is where I'm taking this from. The
Yeah.
candida overgrowth is clinical. There's no test that distinguishes overgrowth from normal growth. Yep.
There was actually another great question about sleep and MS. What are the disruptions that can happen in somebody with MS when it comes to like sleep, like the architecture of sleep? And as
Well,
far as I know, that lots of things can happen.
all kinds of things. So neuropathic pain, somebody noted the myoclonic jerks, um, pain, discomfort are major things that impact it. I haven't seen the research lately. I'd have to go back and look at it in terms of the direct effects on sleep. So I don't know.
Yeah.
I know that sleep can be difficult.
Right. And also, aside from your HPA axis, your hormone axis just being disrupted, circadian rhythms can be disrupted as well. So there are like clearly things we can do to sync up these clocks in our cells with the natural environment so that we can kind of ebb and flow with the natural shifts in the environment. Like
Hmm.
sleep at night, work during the day. There was a recent, not a recent study, but I came across a study where it was looking at nurses who worked like a decade of night shifts. They were 3 times more likely to have multiple sclerosis than nurses
Well,
who did not.
hmm and low vitamin D, which, there's lots with the MS and that predisposes people. But the if you have poor sleep, you may feel after 25 years of MS like there's no way I can get good sleep. You can get good sleep. It's funny. I mean, thousands of people I've treated, I say, there's no way I can get good sleep. And then 4 months later, they're sleeping. You just use the mix of things we talked about, using low doses of a number of things instead of a high dose of one. For the supplements, you can use a standard dose with medications, tiny, tiny dosing, and you'll get your sleep. And then we talked about the lifestyle things. You'd be amazed. Again, I mentioned the eye mask. It's $15, makes a major difference in sleep quality for people. Um, and for the people who are wide awake at bedtime and you're tired all day, exhausted, and then at bedtime your mind's wide awake at racing, and then you wake up at 2 in the morning wide awake in a sweat. That's your circadian rhythm for this adrenal stress hormone being off. And anybody here have that? If I Okay, then let me go ahead and address that. So, um, what happens is our cortisol stress hormone needs to be about 18 is the blood level in the morning. And at bedtime, it should go under 2. It needs to go really low, probably lower than 1. But in a lot of people, that day-night cycle is off. So we can't fall asleep unless cortisol drops. And again, I wouldn't do the test. You can do the saliva. I just, is your mind racing at bedtime? If yes, about 90 minutes before you want to go to bed, I can get on Amazon. It's called phosphatidylserine. There's all kind of phosphatidyls, but Serine. Uh, Take it about 90 minutes before bedtime, so it'll bring down the cortisol in time. Start with 100 milligrams a night for 3 nights, and then see if that works, and then 200 and then 300 milligrams a night for 3 nights. You want to use the lowest dose that works the best because it will drop your cortisol, and that may continue to drop during sleep and cause your blood sugar to drop and then wake you up in the middle of the night, which is what's happening whether or not you take it. That's why you get the middle of the night with your blood sugar. The cortisol stays too high. Can't sleep. Finally fall asleep. It drops. Your blood sugar drops in the middle of the night. You wake up in a sweat and hungry sometimes. So the trick for that is these protein. You have a 1 ounce protein night snack, like a hard boiled egg. That's what I'll do before I go to bed. I'll just, pop a hard boiled egg and it'll help smooth out that blood sugar drop during sleep.
Yeah, handful of nuts, maybe a hard-boiled egg, something small and simple with lots
Yeah,
of protein.
1 ounce or two of protein, meat, fish, even some cheese, although that's not that high in protein, but still. Um, but again, you start with 100 milligrams, 3 nights. You'll know the first night. Give it 3 nights, then 200 milligrams. Give it 3 nights. 300 milligrams. Give it 3 nights. I will sometimes go higher, but usually not.
Got it. Good.
So, bottom line, if you have nasal congestion, we're going to slip over to I for infections. Or if you have irritable bowel syndrome and you sugar crave, candida overgrowth is a good probability. Avoiding sugar, I will use B propolis as a nice chewable one. I think it's called EP300. Uh, it's a chewable propolis, and that's what I like. Andrographis can be very helpful for that, and I'll use a medication. There's a prescription sinus spray from a compounding pharmacy and the medication diflucan. That can help what's called upper airway resistance syndrome, where you can't breathe through your nose at night. It's a cousin to sleep apnea.
Good. And you said when I think I get asked this question a lot about candida, and I generally just have people do a questionnaire if their symptoms sound like it. We work on lifestyle, and then possibly, doing some of these interventions that you spoke about. So, what do we say? Nasal congestion, IBS.
For
Um,
candida, a nasal congestion, sinusitis, irritable bowel syndrome, I'm going to presume candida is present. I have questionnaires in my book that you can do it, and if you score over 70. But the bottom line is, I would toss that in every test out there for candida, and just two questions: do you have chronic nasal congestion? Do you have irritable bowel syndrome? They may say, well, I get IBS um, from small intestinal bacterial overgrowth too, not just candida. Yes, 2 points. The way you tell the difference is when candida ferment, which is what causes people to be gassy, doesn't have much smell to it. When bacteria ferment, they cleave the proteins, the sulfur, it smells like rotten eggs, makes hydrogen sulfide. So if your gas smells like what's called, remember grade school, silent but deadlies, you have a bacterial overgrowth, and then I'll use a berberine and make sure thyroid's okay, blah, blah, blah. But if you can fill a weather balloon and there's not that much smell to it, and you have nasal congestion, I'm going to treat for the candida.
okay, so
Yeah.
shall we kind of wrap up I for infections? Is there more you wanted to
Yeah.
share with us? We talked
Yeah.
about candida.
Yeah. So with COVID, again, the COVID has been politicized, so I'm not going to go too much into it. But for those of you who flared your MS or your fatigue with the COVID, be aware that the medication metformin has been shown in a large sample study, about 1,000 people, as a cheap, safe diabetes medicine. You don't have to have diabetes to take it. It started in the first 3 days of a COVID infection. It decreased long COVID by 63%. Now, we won't hear about that in the media. They gave it, a couple lines online on page 270 somewhere. But unlike the remdesivir, which is profitable, yay, front page, that kind of stuff for remdesivir, even though its effects are like nothing, but anything cheap, it's going to get buried. Sorry.
How was it?
Um,
How was metformin used in that study, and for how long?
They
Do you
gave it for 14 days. And what I can do is you can email me for information sheets if you have chronic fatigue, if you have POTS, orthostatic intolerance, or if you flared with the COVID, you can ask me for the metformin information sheet. These are all free information sheets. And if you look in the chat, you'll see my email address. And you just go ahead and give me ask for the sheets you want. I got fatigue, I've got POTS, I get long COVID, I flare. Can I have the metformin information sheet? Low dose naltrexone for my MS. I'm happy to attach those and send them all to you. Metformin was used for 14 days. They started with 500 milligrams the first day because it can cause diarrhea or vomiting if you started quickly, and then they eased up to the 1,000 to 1,500 milligram dose, I think. But the information sheet has all the instructions, and maybe you can get your doctor to prescribe it by taking the information sheet. It'll have the Lancet study link and the reference in there, so the doctor, if they're willing to look, can say, "Oh my God, why didn't I hear about this?" Okay.
Yeah, no, it's a great way to communicate with your provider. If they don't have the data and just want to know how to do it, it's all there in
One
the
page.
sheet that you share. And Susan's asking about Paxlovid. Um, you know, I
It's
know.
expensive. It's profitable. Yeah. Oh, you mean does it work? Yeah, a little bit.
Yeah. So I like old drugs, even
Please,
with
please forgive me, by the way, for acting like an idiot. I do this stuff to kind of because it's so hard to believe. Like all this stuff I've been hearing in the media is, but it is important to understand why we're hearing what we're hearing. And I'm going to say, but oh well, maybe Dr. Teitelbaum, maybe he's just trying to sell me stuff. So that's a fair thing. I encourage that kind of skepticism. So let me note the simple thing. There is nothing that I'm selling that you need to get well. If you go to my end fatigue website, I'll have supplements there. If you have that concern, I invite you, please, just buy it all on Amazon, except for the Shine Ribose, and you can get other forms of ribose. I won't make a penny on anything you buy on Amazon. So that way you can know, okay, well, I foiled that devious plot if that's what this is all about. You need to be questioning, even me, and then trust your instincts. I'm just trying to give you the information to make informed choices. So anyway,
so all right. So sleep we did. Hormones, would you like to say more about hormones? Because there's a lot of overlap because one thing that you do like stabilizing sleep will help hormones and infections and all of that. So tell us about hormones,
they
what we talked about.
they all interrelate. As you noted, we've already dropped into the H and the I's and hormones and infections, even just talking about sleep. So what we have is we have 85,000 plus chemicals that are in the environment. If I want to take a chemical, and whether it's curcumin or salt or anything, or a new chemical that's never been seen on the planet, if I want to recommend it for treating a disease, you have to pay anywhere between $400 million, or even maybe 50 million if you can get it recognized as safe, like salt or curcumin, to $2 billion in regulatory fees to be allowed to discuss it for any company that's marketing it. But if I want to take that chemical that's never been seen ever and pour it in the water and spray it in the air and put it even in a food supply, oh, yeah, no problem. Go right ahead.
Yeah.
So it's kind of odd. But many of these chemicals block our hormone systems. They're hormonal disruptors. It's a technical name for it, endocrine disruptors. So we're seeing this epidemic of thyroid problems. We're seeing menopause is starting earlier. People's periods are starting younger and younger and younger. And you see little 9-year-olds starting to be sexualized, and getting secondary sexual characteristics. That's the environment. It's scary. Um, so the you want to look at the hormones. The testing is grossly unreliable for hormones. You need to go based on the symptoms. Again, the way we get normal test ranges. Have you ever noticed you go to the doctor and the doctor says, "Good news, tests are fine, nothing wrong with you," and you're like paralyzed on the floor. And but I can't function. The tests are normal. There's nothing wrong with you.
That's when you send them to psychiatry,
Yeah, exactly.
right?
Exactly. But go to the psychiatrist and they'll throw Prozac at you. Um, Finally, after about 20 years in medicine, I started to wonder, where do these normal ranges come from? They never told us in med school. They implied that elders, as I said before, you've heard the story, with big white beards and white hair, that were the wisest in the land, would get together and sit around a table and look at all the research and go, well, if the ferritin result of this test result is in this range, they're fine. No, there's no such thing. Where the normal range comes from is called two standard deviations. It's a statistical term. Put into English, they take 100 people, they do the test, and the 95 in the middle are defined as normal. And that's why when they said a shoe size, the normal range for shoe size would be 5.5 to 13. If you had a size 6 shoe, everybody's normal. For hormones, it's as insane as saying that you have a size 6 shoe, you're fine when you're a 340-pound, 6'8" Texan. It just doesn't work that way.
Yeah.
So how do you tell if you need thyroid support? Thyroid ache, weight gain, cold intolerant, unexplained infertility, irregular periods. Any two of those, I'm going to give a trial of thyroid hormone if the free T4, if the test is not in the lowest 2%, but in the lowest 50%. And the TSH, which is the only test many doctors use, is one of the most useless piece of garbage tests. I can add the PSA to that, but the TSH is a horrible test, especially when you're seeing that circuit breaker that's stressed in chronic illness, the hypothalamus. If that's not functioning well, the TSH test is meaningless. When you
Yeah.
see chronic fatigue, that circuit breaker is malfunctioning. So
What's your target for free T4, free thyroxine?
I don't give a flying damn about what the free T4 shows. My target is to adjust the thyroid to the dose that feels the best to the individual while not leaving them overstimulated. And then I make sure the free T4 is well within the normal range for safety. Because if you look at the research, if the normal range for free T4, depending on the test, they starts at 0.9. And you're funny, you'll go into the doctor and routinely 0.9 and say it's 1.7 is the other end of the normal range. You don't see the toxicity of hyperthyroidism like osteoporosis and things like that until people are in the top 10 to 15%. I keep them as I try to avoid keeping them in the top 15%, but anywhere in the normal range, that feels the best to them. I'm not concerned about the TSH. I know we're speaking in tongue over here. The bottom line is thyroid hormone should be adjusted to the dose that feels best to the individual.
Yeah. And I think different doctors have different comfort levels doing that. Like some will be like, nope, your
Mhm.
TSH normal. We're not going to do anything. But like you
Yep.
said, if your circuit breaker is off, then we got to treat you differently. And you can titrate thyroid replacement to get people to feel good without overly amping them up. So,
Yes. And if you're overly, feel like you have too many cups of coffee, the thyroid dose is too high.
yeah.
Lower it.
Yeah. There's a really good question about hormone issue causes for ED, erectile dysfunction.
Mhm. So here's the thing. The there's a lot of different things, and the neuropathic issues are probably the bigger issue in MS. Uh, Low testosterone can cause ED, but it's more likely to cause metabolic syndrome, which is diabetes, hypertension, high cholesterol. It's more likely to cause depression, loss of motivation, big spare tire around the abdomen, um, and loss of libido. Um, the erectile dysfunction, it can certainly cause that. But the thing is that what the research shows is that if you have somebody with a low testosterone and you treat it, the libido comes back, all these other things I mentioned seem to improve, but the erectile dysfunction doesn't come back or doesn't go away. So the hormonal things are less of an issue, even though certainly the low testosterone play a role. And to me, I consider, the blood test says you're normal if your testosterone is over 208. And for me, no, it has to be over 540 for me to consider it normal. Um, but I'm going to be looking at other things like more of the neuropathic things, diabetes, low exercise will cause erectile dysfunction. So the other factors I think play a bigger role. Low testosterone is a significant player, but it's not the only thing here.
Yeah. And
Okay.
and for men, I do think like just kind of taking, I always kind of like to keep an eye on testosterone because I have had patients that have had really low testosterone levels, and testosterone is an immune modulator. Actually, it helps keep the
Mhm.
immune system ticking nicely. So oftentimes, if I've had male patients with heart disease at a young age, it's like, well, I wonder what your testosterone level is, right? So it's always kind of good to keep tabs on that system as well.
Mhm.
Um,
And let
but
me note that an MS in chronic pain, and fibromyalgia as a model, There is research by Professor Hilary White at Dartmouth that showed even if the testosterone level in a woman is normal, giving very low doses, maybe 1 to 2 milligrams, significantly decreased pain.
Yeah. Yeah. So the hormones play a really huge role. And one other thing that I've sort of that's been on my radar over the last couple of years is estrogen drop right around perimenopause. Men kind of get a steady decline in testosterone from like what, age 30 on. I think women kind of do a deep dip, at around, 50, plus or minus 2 years, I think is like the
Mm-hmm.
normal range. So,
Mm-hmm.
and that's a time where, we can have accelerated bone loss and cardiovascular disease can start showing up. What else?
So here's the thing. Looking at the menopause and perimenopause, estrogen deficiency, first of all, the blood test will not show the estrogen deficiency until you have been deficient for 5 to 12 years. It lags behind. By the time your periods are totally stopped, you have been estrogen deficient 5 to 12 years. And by the time the blood tests go abnormal, you've been estrogen deficient. So how do you tell? Well, are your symptoms worse throughout your menses? Now, I'm not talking about the PMS, which is low progesterone and low omega 3s. Um, but I'm talking about, is the MS worse? Is the overall fatigue worse? Are the headaches worse? Is the cognitive dysfunction, the brain fog worse around your menses? If so, consider a trial of a hormone. But here's an interesting thing. There was work um, out of Tacoma, Washington, as Jonathan Wright did this study, I think, where he gave the estrogen to people with MS. What he found is if he used the pregnancy estrogen, the estriol, their MS got better, and he gave it at pregnancy dosing. Um, but that as soon as he stopped it, the MS got worse again. So the form of estrogen, I'm not a big, the birth control pills if you need them, but I'm not. If I'm going to give estrogen, especially in perimenopause, I'm going to use compounded estriol, and I may do it without the estradiol. Usually, I add 1 to 4 with 1 part estradiol and 4 parts of the pregnancy estrogen. I in MS will just give the estriol. I give it 2.5 milligrams, along with the progesterone certainly, and then I will not stop it. I will not cycle it. I will give it all the way through.
And I think what's really cool about estriol is that it mainly binds receptors in the brain, right? And not so much receptors in the breast that might, change your risk of, a hormone sensitive cancer. So, and I think there's data that the estriol can actually slow down neurodegeneration. That,
Probably so. I'm not impressed with it increasing breast cancer risk.
yeah.
And in fact, the data in general suggesting that these estrogens, not counting the pregnant horse urine, Premarin, which is insane to give them females, but using bioidentical, I've not seen an increased risk of breast cancer.
And I think with
So,
some of the newest data, I think a lot of people can actually benefit from hormone replacement as long as you don't wait too long, right? Into menopause. Like get it on
better, better
talk to
late than never.
you than ever, right? Okay. And question
Adrenal. Go ahead.
yeah. So at what age do you recommend estriol?
And when people are symptomatic, if you feel fantastic, I don't think I'd bother with anything. But if you're getting symptoms that, around your menses, you're feeling non-functional, that's to me the time to start it. And I don't really cycle an MS, like I said. I will just give it all the way through the month. Um, I don't think 65 is too old. I started women 65 and 70 because that's what their body was calling for. They no longer had periods to feel horrible about it, but they had symptoms that suggest estrogen and progesterone deficiency. Progesterone is like our body's natural Valium. So the progesterone is you're going to be anxious. Um, and I'm going to go based on the symptoms. And no, 65 is not too old um, to give it. And I am comfortable using it. Although if I was a woman, I would have been on the bioidentical estrogens probably when I was about 48. And I would just stay on it the rest of my life. And I would include low dose testosterone in it.
Yeah. All right. So
Shall
we
we,
talked,
shall we talk adrenal?
let's do it. I love the adrenal glands, those little guys sitting on each of your kidney. Let's talk about adrenals that secrete cortisol.
Mm-hmm. Because what we're seeing is an epidemic of inadequate adrenal function. And it's funny, most doctors will say, well, you don't have Addison's disease. You've got no problem, damn it. The tests are normal. Seriously, this is kind of the response that you get. Um, and there's no concept in medicine of normal cortisol is about 18, 16 to 18 in the morning. And Addison's disease is under 6 in the morning. So if you're under 6, at 5.9, it can kill you. But 6.1 is totally normal. But I'm bedridden. The test is normal. 6.1, get out of my office. This is what people get. Now, I've seen where the lab, not uncommonly, will accidentally run 2 cortisol levels on the same tube of blood on the same patient. I've had that about 4 times now, and that I've seen that. And those tests, cortisol levels routinely, average being about 4 points apart on the same person, same blood draw. The cortisol level may be 5 on one tube and then 9 on the same test on the other tube. So 6.1 medically is no problem whatever, even if you're crippled, and 5.9 is life-threatening.
Yeah.
And the test is only accurate within about 4 points. It will vary that much, 2 tests on the same tube of blood. So does that make sense?
And this is why you don't treat numbers, right? You treat the patient.
Yes. And
Yeah.
how do I tell if they need adrenal support? If you get irritable when hungry, if you get hangry, that's better than any test. If you get, and if you're not sure, ask your significant others or the people around you, do I get irritable when hungry? And if they're kind of afraid to answer, but go like that, yeah, you need the adrenal support. Or if you just note that you get irritable when hungry. So um, it's very simple. I mean, you're going to sugar crave. So, but when you treat the adrenal, those sugar cravings will go away. We talked about there's 4 kinds of sugar cravings. You talked about candida yeast will do it, but you don't get irritable. You're just kind of what I call the happy Twinkie hunter going through a cabinet. If it's a candida making a sugar crave, the adrenal, it's if anybody gets between you and that Snicker bar, it's like getting between a mama bear and her cub. It's like they're dead. So the way irritable when hungry, there's a supplement called Adrenaplex. Adrenaplex. Has about 8 different things in it: the glandulars, vitamin B5, the vitamin C, all it'll have all those things that you need, and it's cheap, and it'll 1 in the morning or 2 in the morning will smooth those symptoms right out. It really gives um, excellent support. Sometimes I'll use very low dose cortisol, up to 20 milligrams a day, which is like 4 prednisone. In our studies and the others, you don't see the adrenal suppression, and most of the toxicities begin at the higher dosing. But I'm kind of slow to do that. I much prefer the Adrenaplex. It's so, and increase salt, cut back sugar, and I'm going to keep going back to what I said before. There's a Tai Chi move. When you're sitting there and you're watching, something on TV or listening or on the internet, and you find that you're gritting your teeth and you're feeling bad, and take a moment, pause, breathe. Wonderful Tai Chi move like that, and reach to the side, grab the remote control, and go off. You'll feel so much better. Your adrenals will thank you. Sorry
You
if
got
I'm
to design,
irreverent, but you know,
you got to
after 50
design
years
your
as a
state.
doctor, yeah, you got to acknowledge your feelings, and your brain will say, "Well, to be a responsible adult, I need to stay current. I'm in school. They gave me a gold star because I was good on current events, and that's a good thing." So just turn it off. You're not going to be missing anything. You really won't. Um, and your adrenals will heal. You will feel so much better. Find things that feel good. Pay attention to those.
Yeah. It's all the stuff that we all know, but it's
Mm-hmm.
remembering it and actually putting it into action. It
Mm-hmm.
will make a big impact. Like nothing else is going to straighten out your cellular health, right? Unless we start doing these things for ourselves that will work.
Hmm.
They work every time. I always tell my patients, they go, "Oh, I cut out sugar. I feel so much better." And I'm like, darn, it works. It's hard
Hmm.
though. It's hard, but that doesn't mean you can't do it. So,
Hmm. And
um,
once you treat the candida and the low adrenal, your sugar cravings will go away. Or if you're treating it, if you're using it as an energy loan shark, we'll tell you in a little bit when you get to N, I'll tell you how to double your energy with healthy energy in 1 minute a day so you don't crave the sugar. And treating the menopause.
mhm,
People take sugar to treat the anxiety and depression that comes with the menopause. And it doesn't work anymore. It turns against you when you do that. But those are the four things that drive the sugar addiction, and they're not hard to treat. Um, Again, I don't test for candida, Karen, if it's chronic nasal congestion, sinusitis, or irritable bowel syndrome, gas bloating, diarrhea, constipation. If somebody has that, especially if they sugar crave, I'm going to treat for candida. There's no test I would give a nickel for.
yeah. Yeah, and testing gets really murky and expensive, and I think
Not
there's
reliable.
with it. Yeah. Um, oh, let's move on to the N,
Hmm.
nutrition.
Hmm.
And
Nutritional support.
yeah, what do we need to eat? What should we focus on? Because there's, a lot of confusion because we're bombarded by so much information around this diet or this nutrient, take this supplement, and it's
Hmm.
confusing.
Yeah, there's no more that there's one diet that's best for anybody is any more than there's one shoe size that's best for everybody. I suspect one reason we have so much variety available on our planet as human beings is that we each have different needs. Um, so the diet is the one that leaves you feeling the best, not just immediately, but even 3, 4 days after you eat it. So most things, if your body wants it, they're probably good for you, with the exception of sugar. Sugar is an addiction, and you'll crave it. But some people feel better with a vegan diet. Other people look sick as skeletons and really sickly on it. And other people are glowing in the dark. They're just vibrant. So which one are you? The same with any other diet. How does it leave you feel to see what feels best for you? There's no one diet feels on, but there is common sense. If you go and get something so processed off the shelf, look at the ingredients. Everything on the label except the nutrition box and the ingredients is advertising. It's a lie. The name of the product, I guess. But you read the ingredients, look at the nutrition box. And you say, I can't read that. What? So the nutrition box, you're looking for one thing: grams of added sugar. Divide that by 4, and that's how many spoons of sugar are in a serving. So if it says 24 grams of added sugar, that's 6 spoons of sugar. It's like, um, and and read the ingredients, and you're going like, okay, whole wheat flour, good. That sounds like food. Corn, that sounds like food. Hydroxylated bladder, what is? I can't read these chemicals. And when I would teach the third graders each year, when I lived in Chesapeake Bay in Annapolis, I used to teach the third graders a course, and it was called "Food is Food and Junk is Junk." And this basically goes, read the ingredients, and if you can't read it, don't eat it. Common sense.
It's simple, right? I
Yeah.
mean, it is really that simple.
Yes.
I've heard people say, like, if your grandparents didn't know what it was, it's not real.
Yeah.
Can't pronounce it, it's probably not real.
Yeah.
Okay, so eat real food, choose low sugar. What
Yeah.
else should we be thinking
And
about?
take multivitamin. People, it's funny, the media, you'll have the experts who, again, they don't even realize it by and large, but this is basically they are part of the pharmaceutical propaganda machine. And pharmaceutical industry considers natural remedies competition. And now they've extended that to generic medications. They're starting to attack generic medications as well um, as the pharma as the natural things. But you'll see experts that are saying things like, well, multivitamins, you just eat them out in your urine, making expensive urine, you fool. That kind of stuff. Well, I recommend those experts follow their advice and stop drinking water.
Mhm.
because they just pee it out in the urine.
Yeah.
And pretty soon they'll die. So they stop avoiding and irritating everybody who's trying to like get better. And the American diet has lost fully 50% of the vitamins and minerals in food processing. 18% of calories from sugar, another 18% from white flour that's so stripped of nutrients that the government forced them to put some nutrients back in. It's as if a pickpocket stole $100 out of your pocket, and the policeman said, "No, now you keep that $100, pickpocket, but you have to put $1 back in that person's pocket." And they said, "We're enriching you," and they take your $100 and they walk away. Enriched white flour? Well,
Yeah.
no, it's junk. Um, and then basically over half the vitamins and minerals are gone. So it's near impossible without a good multivitamin to get optimal levels of all the nutrients you need. I like one called Clinical Essentials. A lot of vitamins are, I think they're designed by blind people throwing darts at random things on the wall who have no knowledge, or they just do the RDA, which is the what I call the ridiculous dietary allowances. It's enough to prevent scurvy, but it's not optimal.
Yeah.
Hello, Mike from Annapolis. A beautiful place. I love Annapolis. So I recommend a multivitamin. I like one called Clinical Essentials tablets. There's one called the Energy Revitalization System. That's a powder that I designed. I don't make money on it unless you buy from my website. That won't be available till about July. Um, there's another company that's making it again. Yay.
Oh,
Because
oh, it's gonna be back
it's going to be back. And one
because
drink
yeah,
replaced like 30 tablets. It was great.
when it goes out of stock, I'll get emails
Mhm.
from patients, my fatigue patients. They're like, I can't find it, and I'm like, you just got to be patient. So okay, good, it's coming back.
Yeah, the company stopped making it because the company that was making it went into more mass market. And it's an expensive product to make. I mean, it's not expensive to take, but you had over 50 different things in it, and it was a complex thing. So they stopped making it. Another company that I talked to said, "Yeah, we'll make it." So it'll be back hopefully June, July, and it's awesome. In the interim, Clinical Essentials tablets, 2 a day. You can find it. Again, I have it on my website, Amazon, a lot of health food stores. I have it. It's not hard to find, but it's a good multi. It has B vitamins, magnesium, vitamin D. It'll have pretty much most of what you need.
And if you end up taking some of these products and you're taking other supplements, like check the ingredients too. If you're already taking on like a B12, like don't
Won't
overdo
need
it.
it. You won't need it. It won't hurt anything.
Yeah.
But most of
So
these things are in the multivitamin.
right. Yeah. So just not don't end up with supplement buildup is what I call it. So good. Okay. Any other nutritional?
Okay. So I told you that at the beginning of the show, I would tell you two things you can do that in most people in the studies, we did 4 studies over the last few years. Two of the things we studied aren't available in the United States yet. But the two other things, one is called HRG80 red ginseng. It's a special form of ginseng. Um, I stopped using ginseng about 20, 30 years ago because the farm ginseng doesn't work. It's only the wild ginseng that has the active components. But they found a way agroponically to make the ginseng very effective. So it's this specific brand, HRG80 red ginseng. You'll see capsules and chewables. Get the chewables. It'll cut the cost by 75%. In our study, in people who had the most severe fatigue, they lost at least 50% of function. Many were bedbound. Um, the chewable 1/2 to 2 tablets a day. So I'll take when I take it, I take half tablet a day when I want it. Increased and in 60% of people, it helped quite a bit, increasing energy an average of over 60%, from half to 1 pill a day. It's not expensive. So HRG80 red ginseng and get the chewable.
Is it
Um,
is there anything that it interacts with, or medications or other supplements? Can it be used
Not
long
in
term?
real life. Coumadin is a big, everything interacts with Coumadin. But you see all these theoretical things of, well, maybe it affects the enzyme systems and stuff. But I can go through all the foods and say, well, all these different foods and all these things. I have not found it to be a concern.
Yeah.
and I am
Get it
comfortable using it long term.
Yeah, and people can get it. I've seen it on Amazon, anywhere else on your website.
You can get it on my website. I do make what any health food store would make of stuff that I sell on my website at theendfatigue.com. But like I say, if you would like to support the work I'm doing, thank you and appreciate it. But but you can get on Amazon or any most health food stores, and that way you'll know that you don't have to worry that I'm trying to push into anything because I don't make anything with that. There's a question about cayenne peppers, a supplement for it probably has a lot of bioflavonoids and it may have phenolics. I haven't seen much with it, so the proper answer is I don't know. Um, so the number one, HRG80 red ginseng, and then there's another mix of 6 herbs, and this one's only available on my website. So that's something that you know, I'll give that disclaimer. I make it, I designed it, and the only place to get it is nft.com. It's called Smart Energy System. It's a mix of 6 nutrients: ribose, ashwagandha, rhodiola, schizandra, green tea extract, and licorice. We haven't published that study yet. It's been completed. Stamina increased an average of over 80% with the Smart Energy System. Energy increased over 60% too. But this was quite dramatic. And it's basically one scoop that you can put in your coffee or tea or water or food or whatever of the ribose, plus 2 capsules of these herbs and nutrients. Um, so by simply combining the HRG80 red ginseng chewable tablets and the Smart Energy System, most people find their energy within a month, and this is healthy energy, will skyrocket. And I would add a multivitamin to that. So if you're looking for a place to begin to optimize vitality, those 3, very simple. And I
There's
will go ahead.
a question about NRF2 supplements for energy.
We'd like to go with all these things that are fancy and expensive, and we forget the foundations. What if I added a little bit of this $500 per 50-mile thing to my motor and my car that would increase efficiency 3%, and they look at their gas tank and they're running on empty. Like, first, give the foundations for energy, give a good multivitamin, give basic things. And you'll find in the studies that I mentioned on the HRG80 and the smart energy, we also looked at cognitive function, which dramatically improved with both of those. So before I'm going to go with the neurotrophic growth factors and the all these different things and the hydrogen and all the rest to increase that, I'm going to give the body what it needs, the basics. So,
And you
uh,
know what else can, and there's always concerns around absorption. Some of these like really fancy molecules that we've tried to put into capsules, and just because you take it doesn't mean it gets to where it needs to go. Is it crossing into the blood-brain barrier? Like, we don't know. But you know what increases your NRF2 every single time?
mm,
Exercise.
mm.
There you go. There you go. I see people moving. It
Indeed.
works every time. I mean, because that's how your body's wired, right? So you could get a free dose just by dancing, right? Moving, whatever you like to do. So we like cheap stuff that works.
Mm. And do it in the sunshine if you can.
Yeah, sunshine deficiency, right? We don't go out, and when we do, we're covered with
Yeah.
clothes, sunblock, glasses, hat, behind a window. God forbid a little sunlight touches our skin. I mean, there's light receptors in our skin, right? Like your skin wants to be touched by sunlight. So, yeah.
By people, So here's the thing: we know that MS is more common in the northern states where they have less sunshine. And we know that the vitamin D levels are lower in MS. We don't know that it's the low vitamin D that is causing it. So taking a multivitamin is a good idea, but that may not be all that does it. There may be multiple other effects of the sunshine that are helping the health and decreasing the risk of autoimmune issues and the MS that you're not going to get in a pill. You're gonna get by taking your bottom and picking it up and taking it out the front door. You never know what happens when you go out that front door. Quite the adventure. But get sunshine. But it's funny, in medicine, I've seen all these fashions. Remember when I was a kid, bell bottoms were in style, and then they went totally out of style, and they came back into style, and they would go back out. And the things we talk about in medicine go through style changes. I remember when I was a kid, they said smoke Pall Mall cigarettes. You had doctors on TV saying this is a thing, or don't breastfeed, because formula was profitable and being pushed. Um, and we had this insanity where the doctors were saying avoid sunshine. Um, and it's insanity is the right word. And I can imagine 100 years now, they're going to look back and go, were those people out of their minds? And the answer will be yes.
Yeah.
So, what's the proper advice for sunshine? The proper advice is avoid sunburn, not sunshine.
I like that.
Yeah.
Pretty easy to common sense. I love that. Common sense medicine. All right. So in the time we have, let's attack exercise as just something that's going to be really important in supporting sleep, energy, hormones.
Health. And as research shows, even if you look at cancer-related fatigue, there's two things that have been shown to help cancer-related fatigue: the ginseng and exercise. Pain in general has been shown to be benefited by exercise. Exercise decreases pain. Mood. I had a choice between going for a walk in the sunshine and Prozac for people who are depressed. That's a no-brainer. I'm not saying it has to be one or the other. So here's the thing. We, in our no pain, no gain society, have this thing that if it's not hurting, you're not gaining from it. And I'm going to say, that's absurd. Pain is our body's way of saying, don't do that. So I'm going to say no pain, no gain is stupid. Instead, find things you enjoy. Because if you're doing something you hate, you are not going to stick with it. But a couple tips. Number one, when you exercise, have it be something that's fun. Shopping is exercise. Sex is exercise. There's all these things that can be fun. Going for a walk in the woods is exercise. Number two, find somebody to do it with. Have it be scheduled, or you're going to meet somebody, meet a friend, because otherwise you're not going to show up and you won't do it. But if somebody's waiting for you, you're normally it's like, well, I don't feel like it today, and my ear itches, so I can't go. It's like work. But if somebody's waiting for you, these stupid excuses don't fly, and they're going to show up and do it. So, and it doesn't have to be long. Use your willpower to get out there and show up. And then if you want to just kick around and lie down on a grassy place, it's fine. It's, even if you're just doing 5, 10, 20 minutes, most of the benefits are in the first 15, 20 minutes of what you do. And not all of you are going to be able to, some of you, but you may find you can find a warm water pool where you can get in even if you can't walk. There are exercises for people that are bedbound. And you may find somebody who will take you in a wheelchair, or you're going in a scooter and you'll wheel yourself outside. Remember, avoid sunburn, not sunshine. I know I'm repeating myself. Um, just a simple rule of thumb. You don't have to use suntan lotion like if you're a sheep and it's sheep dip. You don't have to dip yourself in it. I will only use a suntan lotion, and I'm an old drag topper. I've had a convertible since I was 17. Um, and if I'm driving across the island and where I live is actually the highest mountain in the world, or at least the tallest. It starts 5 miles below sea level. But we'll get pretty up there when we're going. And if I'm going to be a couple hours in the sunshine in my convertible, I'll put on suntan lotion. But if I'm going out for a walk, no.
Yeah, I'm with you. My kids rarely use sunblock. I think we're usually the only family that isn't doing this like before school, before a game, before like stepping outside. And So far, so good. Yeah, and like you said, avoid sunburns, right? Yeah, when we're at the beach all day, yes, we use it, but it's not what we normally do because we need sun. Okay, so what else would you like to tell us about maybe some overarching themes for people to kind of
Mhm.
step back? Because you shared a lot of information, but like, what if we had to
Bottom line. I've given you all these things that are easy ways for you to optimize and increase energy. And they're healthy and they're not a big deal and they're really, really effective. But if I give you things to improve your health and energy and you do them so you can go back to what made you sick in the first place, you're doing stuff that you think you should do, but you hate. Are you familiar with the expression shoulding on yourself? Well, I should do this. I should do the other. I should do that. And really, all you're doing is it's called shitting on yourself. If it doesn't feel good to you, it's not healthy for you. So use this energy, use your feeling better, use your improving to do things that you enjoy, that feel good to you, things that feel your soul, things that feed your soul, that leave you excited and looking forward to it. If you're thinking, well, I got to get better because I got 40 bags of paperwork that I need to get to rotting in the garage, I'm going to ask you one question. Have you been arrested or homeless yet for not doing those? And if you go like, no, I just think I should do them, burn them. Go play in the flowers somewhere. Go meet with a friend and have lunch. Do things that feel good. Do things that are fun. And you will know by how it feels. Your brain has no idea who you are. Your thoughts are simply the programming that we've gotten as kids from all over the place to make other people happy. It has no idea what's authentic to us. Our feelings know what's authentic to us. Check in with them. Invite them to be your co-conspirator. Be like two little kids having fun. Okay, that would be fun. Let's do that.
I love that. What a wonderful piece of advice to end on, right? Stepping back, reevaluating your priorities, your values, your beliefs, and making sure things are in line and not being afraid to do the things that are outside your comfort zone, right? Prioritizing your health, prioritizing self-care, showing up to meetings like this where you can ask lots of questions and build up your health knowledge base. Like it's really important. So I thank you, Dr. Teitelbaum, for once again sharing with us all of your common sense approaches to just feeling good. Thank you so much. He'll be back because this was only part two. The next part is going to be on managing trauma, depression, PTSD, which often is one of the biggest drivers of an autoimmune process, an inflammatory process. So, like, we want to go upstream and deal with the root causes. And it's
And
so
even stress in general. Doesn't have to be PTSD. It can just be day-to-day stress. Sorry, Susan, go ahead.
absolutely. So, if you were signed up for today, you'll get the follow-up emails for part three as reminders. And I think we got all of our questions. All right. Be sure to send Dr. Teitelbaum an email if you want any of his tip sheets. He's very generous with, communicating some of the, this information to you so that you can share it with your providers if you need more support. Okay. So with that, we'll close our meeting today. Thank you everybody for being here and we'll see you next time.